I'm Pauline Worsfold, as was said. I'm a registered nurse and I'm the chairperson of the Canadian Health Coalition. I'm a registered nurse and I work at a hospital in Edmonton, Alberta, which is Treaty 6 territory. As you know, Prime Minister Justin Trudeau and the premiers will be meeting tomorrow from the provinces and territories to discuss the healthcare crisis in Canada. It's been reported that $70 billion over 10 years is on the table for increases to the Canada Health transfer payments and bilateral deals with the provinces and territories. The stakes for Canadian Medicare could not be higher. There is a crisis in our hospitals that I witness every day when I go to work. Frontline workers are burnt out, feel overwhelmed and underappreciated, and patient care is suffering. They all want to see action by all political parties at every level of government, federal, provincial, territorial, municipal, whatever it takes. This is why public health care advocates will be rallying on Parliament Hill tomorrow to demand of all leaders Canada's public health care system be protected and, in fact, expanded. First, we want increased federal funding for healthcare, and the funding must come with strict accountability mechanisms to be put in place to ensure accountability and transparency. Prime Minister Trudeau must insist that premiers guarantee each dollar transferred from the federal government is used for healthcare, not for tax cuts or wasteful rebates. Second, we want to stop public healthcare dollars from going to private for-profit clinics operating outside the Medicare system because profit doesn't care. In 2020, after a rigorous evaluation of the arguments for and against for-profit clinics, the Supreme Court of British Columbia found private healthcare will not decrease wait times in the public system. On the contrary, it would actually increase the wait times. And this will also worsen the inequities within our system. Federal leadership is required urgently to defend Canadian Medicare and the healthcare system, and in fact, to expand it. It's time the Liberal government finally delivers on its long-standing promise for public universal pharmacare, a national public drug plan. In 2021, approximately 21% of Canadians reported not having insurance to cover the costs of medications in the past 12 months. Close to 1 in 5 Canadians reported the pandemic affected their prescription coverage, with immigrants being twice as likely to be affected as non-immigrants. And that's according to Health Canada. As a frontline registered nurse, I hear about people in our emergency rooms who are there because they've not been taking their medication, likely because they have no coverage and can't afford it. They're cutting their pills in half to make them last longer, and that does not do their health any good whatsoever. It's clear to me as a registered nurse that prescriptions that are filled leads to empty emergency rooms. The CHC, the Canadian Health Coalition, demand the universal drug coverage system described in the 2019 Advisory Council on Implementation of a National Pharmacare Plan, that was led by the former Ontario Health Minister, Dr. Eric Hoskins, be implemented fully. So we demand the plan is there. All we have to do is implement it. So let's just get on with it, I say. Prime Minister Trudeau must deliver on his promise to the NDP leader, Jagmeet Singh, to pass the Canada Pharmacare Act before the end of 2023 And this requires introducing the act this spring. So we have no time to waste. So tomorrow on Parliament Hill, over 20 organizations representing millions of workers across this country are gathering to oppose provincial plans to privatize healthcare services and demand long-promised national universal pharmacare plan. Our slogan, profit doesn't care, stop privatization, pharmacare now. I invite you all to join us there tomorrow on Parliament Hill.